part of the skull, a part of the Norma frontalis. Within the Norma frontalis also there is mandible, but this part is without mandible. We have already seen the mandible, but we are now seeing Norma frontalis without mandible and without squamous part of frontal bone, because already you have discussed squamous part of frontal bone and already you have discussed anterior aspect of mandible. Only this much part. So here the squamous part of frontal bone ends and it takes a turn, 90-degree turn towards orbit. This plate is called as orbital plate of frontal bone, now which have created anterior cranial fossa. Here it is creating roof of the orbit. But where it is taking a 90-degree turn, here there is an elevation. This elevation is arch shape. This is called as supraorbital arch. Now this supraorbital arch, it has got a foramen or a notch. If it is complete, then it will be called as supraorbital foramen. And if it is not complete, if one end is open, then it will be called as supraorbital notch. So one individual may have one notch, one foramen. One individual may have two foramen. One individual may have two notch. It varies. Okay. Now this is roof of the orbital fossa. Now the lateral wall is formed by partially this zygomatic bone, partially by a very small part here, the contribution of sphenoid bone, partially by frontal bone. Then the floor of orbit, it is also partially formed by zygomatic bone, then partially by maxilla. And the medial wall is formed by partially maxilla, partially the sloping surface of the frontal bone. Here there is nasal spine. All these are contributing factor to the medial wall. On the posterior wall, this lateral wall, roof, floor and medial wall march together to form posterior wall, which has got two fissures like greater than and lesser than sign. The upper fissure is called as superior orbital fissure and lower fissure is called as inferior orbital fissure. Okay. From those fissure, structures like optic nerve, ophthalmic vessels, extraocular muscles of the eyeball, all those structures passes through these orbital fissures. Okay. Now coming to below this orbital plate, there is also an arch, but this arch is concave upward. This was convex upward, this is concave upward. Here also you will get infraorbital foramen. Here there will be never infraorbital notch. Here there will be always infraorbital foramen. There may be an accessory infraorbital foramen. One infraorbital foramen is compulsory and there may be accessory infraorbital foramen. And this part is actually varies individual to individual. That gives you the major part of the facial contour. How this cheek region will appear, that basically depends upon the maxillary ear sinus. Some may have a bulged maxillary ear sinus, some may have tapered maxillary ear sinus. According to that, facial contour will vary. Okay. Now this is nasal aperture. Lateral wall is contributed by maxilla and it has got three conchae. In singular concha, in plural conchae, and in between three conchae it will make superior supreme meatus, superior meatus, middle meatus and inferior meatus. Above the superior concha, supreme meatus. Below the superior concha, superior meatus, then middle meatus, and then inferior meatus. So there are 4 meatus and 3 conchae. On lateral wall, there is a nasal septum which is contributed by vomer and perpendicular plate of ethmoid mainly. Vomer, most of the cases it will be broken because it is very thin, but ethmoid you can see on posterior aspect. This is ethmoid. Now below that there is the alveolar process of upper jaw, that is maxillary alveolar process. Here also the teeth formula are same, that is incisor, canine, premolar, molar. Okay, so alveolar process of maxilla. Now coming to this side, here this is zygomatic bone which has a superior process which is getting attached to the frontal bone, which has an anterior process which is getting attached with maxilla, which has a lateral process which is getting attached to the temporal bone and forming zygomatic arch. Okay. Now this zygomatic arch also gives facial contour. If this zygomatic arch was absent, then this facial appearance will have been much uglier. Without this zygomatic arch, we would have been very ugly. More importantly, this zygomatic arch protects here many important vessels and nerves. This zygomatic arch protects this area from where there are numerous blood vessels, nerves, lymphatics, which is protected by this zygomatic arch. Okay. Now, if we see the inferior surface of this maxilla, each half is getting joined at the midline, and this part is forming hard palate. Beyond that, there will be soft palate. Okay, so this much is the middle portion of Norma frontalis.